suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Does it look irritated?
No.
Honestly, not at all?
Not really, no.
So I'm going to get reception to call an ambulance, all right?
I was wondering if it might be possible to have a little wee for me.
That's so little.
I know.
That's so little.
I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Okay, here we go.
Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay. Is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't, like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
So like I might need a few days just to gather myself, and it's something that's documented that I've struggled with for years, but right now I'm scared that it's only going to get worse.
Okay, all right.
When I was younger, I would literally lock myself in the bathroom and they would have to call like the police and stuff to come and get me out, and I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you, though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those?
Yeah.
Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder because what propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay? Like you did today. If things don't improve, just give me a call.
Perfect. Thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Could barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that just had too much air in. I couldn't get out.
So it just like, instantly I'm just like, I can't breathe.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better. And then probably, I think, Friday last week, it felt not so good. And
How many puffs have you had today?
About 6.
Okay, I'm going to get you a nebulizer now so that we can talk a bit more, okay? I might need to come and sit here, just so you're next to the... I can plug this in. All right, when ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. We're going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate of 60, despite a nebulizer tell them, so they need to come in now.
If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly. Speaking, how can I help?
What's your date of birth, please?
Vicky speaking, how can I help?
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again for what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days, despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon, okay? Thanks, guys.
No.
Thank you. All right, thank you, guys. Good luck. Take care. Poor love, she's just breathing. Oh, she's terrible. So fast. Yeah. Really frightens me when they're that bad, because, anyway, poor love.
Relief in one sense, when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Hi, how can I help? I've just been waiting a while now. Didn't know if you've got me.
Yeah. So, because there was a medical emergency a while ago.
Yeah,
you'll be
line.
next. She just seen someone else. Sorry about the delay.
Don't worry.
Thank you so much. Bye. I can't decide if my headset's playing up or I'm speaking to a lot of deaf people today.
What do you think it is?
I think it's the headset. But then I speak to somebody else and
it's
everything's
fine. Yes, one of them ones, please. Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh,
Sticker.
a sticker? Yeah, you can have a sticker.
For you.
Even though you didn't have an injection, which one would you like?
Now, would you like a sticker?
No.
No? That usually works.
Come in. Sorry? Oh yeah, of course you can have a sticker. Look, I've got flowers, butterflies, cars, dinosaurs. A dinosaur one, I think that's a great choice. There you go. Can I have a high five? Very good.
Right. Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy, I know what the problem is. So, when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, OK.
But everybody else was in T-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or?
I'm okay.
You're okay, you're fine. Can I get your dad's take on things?
Yes,
See what he reckons.
Obviously, they saw him putting on a coat when everybody else was sweating, so they took his temperature and he was very hot.
OK.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success?
We have.
Oh, look at that. What I do is I just dip my little bit of paper. It's quite clever stuff, really.
That easy, isn't it, Dad?
Yeah.
It's easy being a doctor. OK, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated. Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Bye, Dad.
Okay, cheers, thank you very much.
Nice to see you, babe.
Thank you.
Take care.
Thanks a lot. Cheers.
It's a pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Does it sound any different if I talk to you on this?
I can't hear at all.
Ah. And you can hear me okay on this one?
Yeah.
Okay, thank you.
You're welcome. Antonio speaking, how can I help?
Hello, Miss Murray. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat, and then I have to go and pass a stall.
Yeah.
The pain that I get, it's like you're open, but that you're not closing up. I don't know, like it hurts. a bit.
But no bleeding from the back passage or anything like that?
No. It can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach, and that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
How's it going?
Kim, Erin and I were saying you've been so... You look like you two were kissing and then you turned around. Erin, like, she cool.
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
It's been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky now.
Have you missed me?
Oh, yeah. Well, I miss you, but not coming around here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Oh, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That's the only reason?
No, I like you as a
I was going to
person,
say.
And as soon as you got that colour...
using me for my blood technique.
Definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black. Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holidays yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see, like me, a healthcare assistant, a doctor and a nurse. So, and they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this. You know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them. So yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and come.
Oh, lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home with me.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy, because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
Aaron speaking, how can I help?
Right, have a seat. What can I do to help?
I had some fertility tests last year and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist and he explained that I was kind of slightly below average but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
OK. I've got a set of sperm results from the 1st of May.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist and give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean?
OK. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance.
Of having a kid?
Yeah.
OK.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yes, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all? One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So I had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially, I was scared it might be an internal, but it wasn't. The bleeding was actually
from there.
From there.
Okay. So you've got here seeing the Royal Marsden Hospital this Thursday. Okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay. Yeah.
And he's also going to have chemotherapy.
That's a lot.
Just a damn sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can be, especially at night time.
You're on the omeprazole, the propranolol,
Yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or up my bum.
Oh, Charles.
I did. So I quickly learned how to swallow it.
As an alternative, a third option, you could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets, you're okay swallowing
absolutely.
them? You can make them a little bit stronger if you want.
Just slightly stronger.
Slightly stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No.
Yeah.
My sister, one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away. Do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely.
Yeah.
If Charles was happy with
Absolutely,
it.
absolutely.
And you have...
Absolutely, of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell, she sounds, and you need to...
Yeah.
You need to go over, and if you've got somebody... Not the child you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help...
I'm a very different patient.
You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very unrecognised role. Across the UK, they estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And I know
good Lord, I've got a lot to do yet. Right, but we won't
Sorry,
take
so-
any longer. Thank
Okay,
you
no,
so
not
much
at
for your
all.
time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
We
great.
could do that.
Yeah.
And then,
That's very kind
but
of you.
anything in the meantime, I'm
You're
happy
so
to keep
kind.
Not at all.
Thank you very,
Not at all.
very much indeed.
No, okay. All right, bless you. Oh. Okay.
Thank you.
All right.
Thank you for all your kindness.
You're very welcome.
Take care. See you
You
soon.
take care.
See you
So,
soon.
okay.
Bye now.
Bye-bye.
Bye-bye.
All right.
Vicky, I'm going to win the lottery, okay? I just thought I'd tell you.
Just in case you do, I just want to let you know how much I like you.
Who are you?
If you feel you need to be seen, and I can arrange for an on-call doctor to call you. If they need to see you, they will arrange a time for you to come in.
Perfect.
To practice.
Yeah, practice it in front of the mirror.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This right away to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. He had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his
Roll
through
backwards.
back. And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me.
Oh.
I'm out, but I just thought, what am I going to do? But anyway, I know, but I'll be all right, I have to be. I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a carers association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling, and I think that's an important outlet for her.
I can't fix my hair up.
Brush it.
I have.
No, you haven't, Pa. Brush it properly.
Watch.
That's not brushing it. It's not even black. How are you not? This is brushing.
Yeah, but ow!
You have to brush it. It's called brushing.
Don't. You're hurting my scalp.
Oh, shut up. See, that's what it's called
Yeah,
brushing.
but I don't want it flat like that.
It looks nice. It was sticking up before, like the Mad Professor. You look like the Nutty Professor.
You are the Nutty Professor.
It looks nice now.
Yeah.
Mr. Maury, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. And Miss Moore, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always a possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay. Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from... Let me show you the letter from the hospital.
Yeah.
So...
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
You take your time. Do you want a glass of water or anything?
I'll have a glass of water, please.
Let me get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There we go.
Oh, thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today. Yeah. And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said,
Yeah.
the big C,
Yeah.
to quote, how long would it take to happen for me to, you know?
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So, this type
because I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, you know, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Huh. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when
Yes.
we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, you know, if you've got any more
Today?
questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor.
Okay.
If anything happens to me, in the meantime or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, you know, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Ed.
Okay.
Thank you very much for your time and your concern.
No, not
I
a problem at all,
appreciate
Mr. Roy. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be
Okay.
here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Shit. Shit. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. You know, but then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
I didn't win the lottery.
I still like you though.
Yeah, I'm not going into the I'm not going to go to the meeting.
Okay.
If my patient comes in, will you just let me know?
Okay.
He said he might come. He said he'd come back at 1 o'clock.
Which patient's this?
Mr. Murray.
Okay.
So, let me know when he gets here if he does.
Hello,
Hi.
Hannah. Come and have a seat.
Thank you.
How are you? What's happened?
I don't know, my eye, and I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started like, it felt like there was something in it. And I've spent ages putting my finger in it, which obviously hasn't helped. And then I thought it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some like fluid, it was been really watery, but then it seemed like there was some creamy coloured.
Discharge.
Yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was just literally, my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So...
There's nothing wrong with it, is there?
Well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and
Yeah.
sore.
Does it look irritated?
No,
Honestly, not at all.
not really, no.
Oh, I've spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No,
Okay.
I agree. It feels like a bit much.
It does feel like a bit much.
Because your eye essentially looks completely fine.
Yeah.
Sex so much.
Okay, all right.
I'm really feeling down. I'm feeling really suicidal. It scares me at the moment.
You aren't the normal Sammy that you were a few weeks ago.
I don't think I need any medication.
Right, okay.
I definitely don't think I'm getting ill.
You've got to remember that you're a very good age. Sometimes you've got to slow down a bit.
Yeah, I know, and I don't want to slow down so much.
Any thoughts regarding work? You're 33 and not worked for 10 years, and
Yeah, it's shocking.
the chances of returning to work are
dwindling as we speak.
Yeah.
I know.
Morning.
How can I help?
Okay, that's all booked. Bye. It's going to be a good day, Nana.
So anyway, how are you getting on?
Well, I'd like to ask you a question, whether you can answer it or not, I don't know. And that's the nicotine, I think, from smoking, has lodged in my arteries.
It's not the nicotine that's doing that to you. It's all the rest of the rubbish that's in a cigarette and chemicals.
Yeah, it's a fine dust, basically, isn't it, smoke?
Yeah, well, it's killing you. And that's what's going through your arteries. How many cigarettes have you smoked since you saw me Thursday?
4, 8, about 12.
Okay, so I thought you were going to use the patches and the gum and not smoke. That was the idea of this.
Well, I did, but I cannot resist.
So you're still craving for cigarettes. So then the regime that I put you on is not high enough. You've got a 4 milligram gum. Have you been using the gum?
Well, I don't like to criticise it, but it's inclined, I think, to give me like indigestion.
Yeah, it does. It can do. It can do.
You know about that, okay.
How about a lozenge? I tried to try a lozenge instead. So what you do is you suck it and you park it, you suck it and park it, and you keep doing that.
What flavour are they?
Mint.
Oh, yeah.
Is that all right?
Yeah, that's fine. Very limited on that, I expect.
Oh, there's not a lot of choice, I'm afraid.
No.
Okay.
I'm not being picky.
Okay.
I'd like to try them if I can.
Okay, and I'm going to up the patches, so 5 extra milligrams in it. And we'll see if that regime helps then.
Okay.
So, are you going to come back and see me next week?
I have to check my diary. You see.
Okay, well, I'll make a new appointment because you need to see me. This is something you need to come back and see me for.
Okay.
All right?
Yeah.
Hey, little man. Hello. Hi. Hi.
I'm so sorry. Yelp if you need me to.
Oh. It's all right.
But we're just concerned that he doesn't seem to be...
It's tough coming into the big world, isn't it?
Calming down, gaining weight. He has gained weight.
So what are the things that you've noticed, Barbara, that make you worried about Sammy?
So there was lots of things which changed. So, for example, you are more energetic than usual. So it seems like the reactions are much stronger than usual. Also, you sleep with service charges, which never happened before.
Sorry, what was that?
Stopped paying service charges, which is very unusual for
okay,
you.
so you have to pay service charges?
Yeah.
But you're not doing it?
No, I'm just behind in arrears. But in a week's time, I'm paying about £100 towards that.
How did that happen, that you got in arrears?
I just slipped behind in payments.
Right, but then you must have spent the money on something else.
Yeah.
So what did you buy?
I just bought shaving, grooming kit.
Must have been a lot of money on that.
Yeah.
Why did you spend so much money on those things?
I don't know.
Did you really need them, all of those things?
Yeah, because I groom every day.
Yeah, but you obviously you used to be able to afford to buy what you needed and pay the charges.
Yeah.
But were there other things that you bought?
Some shirt, t-shirts, underpants, and cologne.
All right, okay. Bipolar disorder is usually really quite a severe mental health problem in which your mood can either be very high, which is we call either manic or hypomanic, or really very low, depressed. People become hyper. They often buy loads of stuff. Often people will buy things that they can't really afford. They may think that they're famous. I had a patient who bought a ticket on Concorde because he thought he needed to go to the States straight away for no particular reason. I mean, obviously, you've been living at the hostel there for a long time now.
Yeah, 5 years, 4 months now. Today it's 5 years, 4 months.
Is this the first time you've been in arrears?
Yeah, first time, yeah.
So something's not right, is it? Because you wouldn't normally allow that to happen, because you're very responsible.
Yeah.
The worry that I think Barbara has, that you're beginning to show early signs that you might actually be relapsing.
No. Because the thing is, I saw my consultant psychiatrist on Saturday.
Did you?
Dr. Potter. Yeah, I saw him on the street near where I live.
All right.
And he said I look very well.
Right. You can't tell what's going on inside your head from just looking at you, because I would have said you look very well as well.
Yeah.
And the thing is that what we know with the kind of problem that you have, that when people relapse, the first thing that you notice is not that they don't look well. They look fine. And it's just what they're doing isn't quite normal.
We've been here for 20 years.
Yeah. You know, it's a nice place to work and everybody's
That's exactly
pleasant.
what I said at my place
Yeah,
of work.
you know.
Why is everyone getting flowers? I want flowers.
Oh my God, is he being serious? I want flowers. Aaron, send me flowers, please.
Gonna feel it, then I'll clean it with this alcohol wipe.
You're very practical about the shop. Most men are not practical.
How far do you have to be out of the borough to still be here?
So, we
'cause
have...
I don't want to leave here ever.
That's lovely.
Thank you so much.
No problem.
Thank you very
All
much,
right, then.
Dr. Sherlock.
Okay.
Thank you.
Bye-bye.
Yes, thank you.
I think that these are warning signs. If we don't do anything, you will get ill. And we really don't want that to happen again, because you've rebuilt your life. You've been absolutely
Well, today
fine.
is 5 years, 4 months
Yeah.
since I was discharged from the hospital.
Yeah. So you've done.
And within myself, I know if I was going to feel ill when I was.
Okay, is that really the case?
Yeah, I know.
That you know? Because most people with your illness don't.
Yeah.
It's very unusual for people with your kind of illness to know. It's always other people who say you're not well, and that you have to then accept that they're right, and that means you should be on treatment.
How do you feel about that, Sammy?
Well, at the moment, I don't think I need any medication. I think I've done well 5 years and 4 months since March 29th, 2010. I was discharged from the hospital.
Yeah.
I motivate myself, I go for walks, my weight is coming down. I don't think I need any medication.
Right. Okay.
I definitely don't think I'm getting ill.
Right.
I feel well within myself.
Okay. Well, our advice is you aren't the normal Sammy that you were a few weeks ago, that you've changed. You aren't as well as you were. You can't notice that. You can't see that. And that's often the case. In Sammy's case, I thought it was really important that he should be on medication now, because it sounded as though he was beginning to relapse, and that could have been disastrous for him, as he might have ended up in hospital, because he wasn't taking any medication for bipolar disorder and hadn't been taking any for quite a long time. We would generally say to somebody like you really ought to be on medication forever. When you get ill, you get seriously ill and you end up going back into hospital. It's such a huge setback if that happens. We think we can avoid it now. All you need to do is to restart treatment. He is a patient, actually, he does get the final say as to whether he takes medication or not. He's taking a chance if he doesn't take it, but then maybe he's entitled to take that chance. Are you willing to see the psychiatrist?
I'm willing to see the psychiatrist.
So we'll do that. We'll do one step at a time.
Yeah.
I do think it's worthwhile going down this route. So what I will do then today is I'll phone them up. I'll try and arrange that you get an urgent appointment to be seen as quickly as possible. I'm sorry, you're obviously upset about that.
Well, I'll see the psychiatrist, talk to him.
Yeah.
He can assess.
Yeah.
He'll assess me, and then he'll tell me if he thinks I'm getting ill or not.
Yeah. Okay.
I think it will be the best thing
Yeah.
to do
Okay.
right now.
No, you're right. That's a very that's the right way to do it because they're the experts.
Yeah.
Thank you
All
very
right.
much.
Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Yeah, take a seat. All right.
Morning. So, is there anything about your health that you particularly wanted to discuss today? Asthma is another of your medical problems. Is that well controlled, or
What, asthma?
Yeah.
Well, no, I have had a bit of breathing problems recently. Not bad, but I'm not breathing as deeply as I would like to.
And you're using
I've
your
had some-
medication?
Yes, I've been using that.
Do you know what triggers your asthma? What makes it worse?
Well, I think that it's the pollution,
Okay.
the heat, the pollution, the traffic,
Yeah.
the high road.
Have you had any falls, or do you worry about falling?
I could walk without the stick, but I'm not confident on the high road because of the kids.
Well,
on
the road is very uneven.
It's very
and there's lots of
uneven.
people about, isn't there?
And there are too many people, and they
Yeah.
don't notice you, and they bash into you, and I mean, I really think it's safer to have a stick. I think actually what I'm objecting to now is the scooters. There's so many of them.
Yeah, and the little kids as well.
And
They
grown-ups
go
on
ahead of
scooters.
their parents, so they can't even.
Exactly. They
Yeah.
don't know what they're doing. Parents are usually on mobile phones anyway.
But you feel well in yourself? Do you feel well?
Well, I feel a bit miserable sometimes, but mainly, I mean, it's just not getting around as much as I did.
The mobility.
It's just a bit depressing not to.
But I think
Not
also
to be
you've
as
got
active
to
as I would like.
remember that you're a very good age, and so you've got to you know, sometimes you've got to slow down a bit.
Yeah, I know. Well, I don't want to slow down so much. I mean, I do feel I've got to get out. That's why I decided yesterday I've got to go out. So I took myself, as I say, I went to Collier's Wood. And then I felt quite pleased with myself that I got there on my own, you see, on the tube without depending on somebody else being there. And then I went to Mark's and had something to eat and came back home and felt fine.
Have you ever heard of the befriending service from Age UK?
I've heard of it, but I don't think I need it. I've got friends.
You've got enough friends
I've
around.
got a friend who came in this morning, actually. I mean, I think changing the focus does help, and I think probably if I go on holiday, I will probably be able to do it.
Well, have a wonderful holiday.
Yes, it's only a week.
Well, a week is better than none at all,
A week's
isn't it?
better than nothing, yes. Okay.
All right, thank you for coming. All right, bye-bye.
When are you looking at doing your work experience? Okay, so I think this coming week might be too soon. But if you wanted to write in, then I'm sure she would consider that.
That's the only time I come in. Very good. Come in, take a seat. Busy day, indeed. Always. William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, you know, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment? Any thoughts regarding work?
I mean, I'm still at that. I say crossroads. It's not really a crossroads. I feel like I'm just at that precipice with like no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago, really. and the gap in my CV is just so like huge.
Yeah.
That like I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well. But I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, we've got you're 33 and not worked for 10 years. And
Yeah, I
you
know, it's shocking.
The chances
Shocking.
of returning to work are
dwindling as we speak.
Yeah.
I know.
We
I know.
want you to become productive again, and you know.
I know.
think whether
I
or not
had big dreams. I had big dreams. Like this is what my first like couple of counsellors was saying. Like, yeah, you built yourself up too high.
So
mate.
the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's
At the moment.
literally that's my only option from counselling.
From a counselling point of
is
view.
through the drug angle. See, I'd rather talk to a wall than talk to someone like condescending with their.
Yeah. And you've said before.
I mean, what
you said
to
before?
me? What's the alternative? Go and have a drink? Like, no thanks.
Yeah,
I'd
you
rather
said,
die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like,
Do you know which medication that was?
I think it was fluoxetine.
Fluoxetine.
It's like.
What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks.
Okay.
And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay. Take
Have a
care.
nice day.
And you.
No problem. All right. Bye. Good morning, Vicky speaking. How can I help?
Yep, they'll be ready to collect after 4 tomorrow.
All right. Oh, bear with me. Hello? Would you like your daughter to come through?
Yes.
Yes, please.
She's my next of kin and she
Lovely.
does everything for me.
Hello, how are you? Come in, take a seat.
Like an idiot, because I've just been swimming and I've gone completely deaf.
Oh no.
Well, not completely, but I've got one question while I'm here. I was sorting through my pill drawer, found this packet, which is only February, and I've no idea what they're for. I hope it's not something I should be taking.
I'll tell you. That's one I don't actually know.
I can't say it, that's for sure.
So nausea and vertigo?
Oh, I know what it is. I had a very strange giddy turn.
Yeah, there you go.
And my neighbours all thought I was having a stroke.
Oh,
I was talking strangely and...
Did it just suddenly come on?
Yeah, and I was trying to use my mobile to ring somebody and I couldn't sort of coordinate properly. Oh, I can't look at that.
And it was nausea and...
I'm just trying to think of the name of it. Gone from me as well.
Was it about your ears? Was it to do with your ears, the balance?
I think so, yes.
Labyrinthitis?
Yes, that's it.
Mm.
It was very frightening
Yeah.
because when I couldn't use the phone and I was feeling unsteady and I'd thrown up all over my flat, but I got to the front door and the dustmen were just there and they were wonderful. They
Oh.
went down the road and got my friend for me.
Did it feel like you were on a boat?
Yeah.
That's the imbalance of the ears.
Yeah. And I wasn't speaking clear. Oh, God,
Mm.
that's all the signs for a stroke.
And of course, once you start to worry,
Yes.
that makes everything worse, doesn't it? But it's natural to worry. There you go.
Lovely.
All done.
Thank you very much.
Pleasure.
Now I'm killing time. I've heard yesterday that I've got an appointment at George's this afternoon.
Oh,
So I've
okay.
got an appointment at the skin clinic. So
Oh, you getting around this
yes,
week?
absolutely.
Nice to see you, always.
All the bits are being checked.
Take care. Bye-bye.
Yo, yo, yo.
Hi, Patrick. Come and have a seat. How are you?
Not great.
So it's been a while since I saw you.
I'm really feeling down. I'm feeling
Yeah.
really suicidal. It scares me at the moment.
So I had a letter from A&E from a couple of weeks ago. What happened?
I ended up going to St George's,
Mm-hmm.
which I got an initial assessment, and I waited for about 4 hours and basically discharged with 2 leaflets. Nothing.
When anyone ever comes in and tells us about them feeling low or feeling down, it's really important to explore with them exactly how extensive those dark thoughts are. Are they just something that they've had a fleeting thought that would be a lot easier if you weren't alive? Or actually, is it more planned than that? Have they really thought through what they may do, and what steps have they taken to try that? So had you done anything to actually hurt yourself, or was it just the kind of number of thoughts of it?
What happened is I started drinking and I knew that was dangerous, so I stopped drinking when I phoned, and it was the thoughts that where it would lead.
And how much are you drinking at the moment?
I'm sort of drinking every other day, and when I'm drinking it's probably about 6 cans of cider or 2 bottles of wine, that sort of drinking.
Mm-hmm. So that's kind of crept up quite a bit, hasn't it?
Yeah, from not drinking at all and slowly coming back to it, I mean, that's what scares me. If I'm depressed and I'm anxiety, if I put alcohol on top of it, it's dangerous. It's really dangerous.
You're seeing Dr. Sayer this morning. He'll see you up to 15 minutes late, so hopefully you'll be here, but I'll put him a little note.
How are you? Good morning, you all right? That's it.
I must stop coming in here because I was in yesterday.
Well, just bring your bed.
Any pain with it, or is it just more?
Yeah, it is. It is a bit painful. It's a bit of a joke in our house that it's a repetitive strain injury from fishing.
It might be a joke, but that's probably what's happened.
Right.
How often during the last year have you been unable to remember what happened the night before because you had been drinking?
Starting drinking again is a warning sign that, and it distorts everything, and then it brings in the depression and the anxiety, and then I don't know which is which. I don't know if it's alcohol related or am I using alcohol to solve it, but it's dangerous.
It goes hand in hand often, doesn't it?
Yeah.
So the drug and alcohol service, what help are they giving you at the moment, or what contact have you got with them?
I'm going to see them for an assessment. It's a drop-in, and they like you to turn up at least 3 times a week.
And how motivated do you feel about that at the moment?
I really have to do that.
Good.
Because, see, I'm isolated. I'm in my bedsit. I'm feeling sorry for myself. I'm getting depressed, and it's dangerous.
Okay.
Sometimes I just feel like, oh, what's the point?
Mhm.
It's just a game. But as you say, there's not a lot you can do right now. It's a slow process.
But it sounds like it's moving in the right direction in terms of the things that you're doing.
Yeah, and the medication I'm not even too sure, but I mean, medication doesn't work with alcohol, so...
No. So how much, you're having 150 at the moment, is that
Yeah.
right? Yeah. And you're still having it every day, or?
I'm still having it, but alcohol just neutralises it or something. I don't know what it does, but...
Yeah, so alcohol's a depressant, isn't it? So it kind of switch, I mean, there's no point in having an antidepressant
Yeah, when you've got a
if you're going to take a depressant as well. Yeah. So we know that you've got a lot of insight into things, don't you? You kind of know how things go. You've done this merry-go-round.
Yeah, the counselling, it seems to be going okay. It's something I've been looking for over a year.
Yeah.
And I finally got it, and if I finally got it, for Christ's sake, tell her what's going on.
Yeah.
Because I tend to tell people what I wish was going on. I convince people I'm actually okay.
Yeah.
This other woman from Once With Mind, she's really helpful. She contacts me about once a week.
Okay, so that's extra support there.
Yeah, and it makes a difference. And
Good.
she's the one encouraging me, do this, and it's like somebody giving you a checklist, and it's so helpful, because you just do it.
Good.
Yeah.
Do as you're told.
Yeah.
All right, it's nice to see you, Patrick.
Okay, so that's everything. Okay.
Talk later.
And then-
Okay.
Cheers.
Bye.
Yeah, a half an hour appointment, and you say that you can never get hold of me. I'll give you half an hour of my liquid gold time, and you're not even here. Oh, what? So 4 o'clock next Wednesday.
What's brought you in today?
Basically, I have been having like pain in one of my breasts,
Right.
and I wasn't sure what it could be, basically. I'm probably like a little bit oversensitive anyway because my mum had breast cancer about 3 years ago, so it's something I kind of keep an eye out for.
What's happening with the pain?
It's not really, it's kind of just like a bit of an ache, and it feels like more like bruising.
Okay, and how long has it been there for?
About 3 weeks.
Okay.
It was kind of straight after my period and has carried on.
Okay, and are you on oral contraceptive or not? No.
No.
Okay. I wouldn't think much more of it at the moment
Okay.
in someone that is your age, in
Yeah.
24.
I was just really worried, I think, just because of
What
kind
happened?
of everything.
Yeah, understandable.
But I just
What
thought
age was she?
She's actually had cancer twice. So she
On the
had,
breast twice? Or
no, she had a lymphoma when she was about 26.
God.
And then breast cancer recently, and she's about 47, I think.
Okay.
So, because it's kind of a pattern with her, like I recently have been, the last couple of years have been kind of a bit more.
And is anyone else in the family that's had breast cancer?
Yes, one of my great aunts on my mum's side. So she got diagnosed shortly after my mum did. So,
okay.
yeah.
But she's a great aunt.
So she's my mum's aunt.
The mum's aunt.
Yeah.
Okay, yes, yeah, okay. So I always think it's quite a useful form. This is from Oxford University with their for their cancer genetics referrals. So if your mum had been diagnosed below the age of 40, one close relative, then we would be at that point we would be saying, well, actually maybe we'll do some genetic testing. And there's a couple of genes like the BRCA gene which are closely related to that. And often then you see if there's someone's got a BRCA gene, probably there tends to be several people that have had problems. So it might be somebody that presents very young, but there could also be two close relatives with breast cancer under the age of 60. So we're not sort of approaching any of these criteria. So we're not really thinking about increased risk. So I think that's hopefully quite a reassuring thing to
that
think
is
about.
very reassuring, yeah.
I think in general practice over the last few years, we've certainly seen a difference in the numbers of people presenting with very vague symptoms who are very concerned about significant underlying causes for this. There's so much coverage in the media of missed cancers and so much concern that any symptom could well be cancer. If you ended up with this sort of breast pain that was ongoing and it was coming from the breast tissue, then we would refer to a breast clinic at that point.
Okay, so just keep an eye on it, basically.
Really would, yeah.
Okay, cool.
The real challenge in general practice is trying to identify the patients where those symptoms are important and we should be investigating them further. So yeah, I wouldn't worry too much about that, and then I'll just see how things go.
Yeah, okay, brilliant.
Okay.
Great, thank you very much.
No worries, take care. Have a good afternoon.
Thanks, you too.
Bye then.
$10:30, is that with Dr. Shah? All right then, take care.
All right
Bye.
then. Hi. Are you showing the way to go?
Okay.
Yeah.
Thank you very much. Oops.
Who's this? Is this your...
No, this is my friend's
Your
grandson.
friend's grandson. All right.
Angela suffers from high blood pressure and comes to see me regularly to monitor this and to get her blood pressure medication. On the last occasion, we also discussed her addiction problems, and we agreed she was going to go to the drug and alcohol support team to try and help with this.
I get the shakes, and I'm literally holding the can like that to drink it. I'm so sick of me. So sick of me.
Should we do your blood pressure? You've been taking your tablets?
Okay, yeah.
Yeah?
Yeah, absolutely. Come closer.
Blood pressure is great. Sorry to
Is
interrupt. I've never seen it so good. 119 over 78.
Oh, brilliant. Happy days.
So what happened then?
I broke it. I broke these bits. I can't remember. Sector cranium or something. What are you doing? Oh.
So what actually happened then? You were in a fight. Who was the fight with?
Doesn't matter.
Okay.
But the thing is, he punched me right here. It's gone down. But it was so there. It was there. It's the lump is still there. I said, if you're going to X-ray me, X-ray my head. But they didn't. But I went after 3 days after the fact. It just got out of hand. He went like that. And that was it.
How much?
So he punched you first?
He did, yeah. Right, yeah. It's still there. It's still like it's going down, but it's still.
Yeah.
It was all over. It was all over. I even called the police.
You called the police?
Yeah.
And did they?
Because I took the knife and I went for him and I just thought, Angela, just leave. I ran with the knife and everything.
Okay. So where do we go from here? Did you ever go back to IDAS?
Of course, yeah. Oh, yeah. I'm still liaising with them. I've got an appointment. Of course. I need them. I can't do this on my own. I need you all.
Do you have a social worker through them? I ask you this all the time. But...
No, I still haven't. And I've not for want of trying. No. They didn't even bother with me. I don't know why.
And this, you're seeing someone,
Yeah.
Is she like your caseworker? Or
She is.
Is she good?
It's very hard for me as a 44-year-old to deal with somebody who's in their 20s to tell me what. You know, it's embarrassing. I feel embarrassed. But,
What kind of things do you talk to her? Is it focusing?
I don't talk to her about anything, to be quite honest.
Okay.
With you. She's too young. I can't work with her, to be quite honest with you. I've got children her age, man,
Yeah.
or a child, my daughter. It's not cool. I don't feel comfortable. I really don't.
I mean, you can say that. You can say it doesn't need to be a personal thing, but due to sort of age difference, it's not someone I feel.
Isn't that not age discrimination?
No, it's completely within.
Ageism, is that what they call it?
Yeah, but I think it's fine. So it has to be somebody that you feel you can speak to and can help you.
I'd rather somebody else I could speak to.
I'm going to try and just speak to them at IAT as well about this. If you can give this, I've just put it together with the appointment. This is a letter. If you can give that on Thursday.
Yeah.
If you want to ask for someone different, that's up to you. I haven't said anything. I don't want to compromise. I'll give you 3 months of your blood pressure tablets.
Yeah,
Make it awkward
I
when you
appreciate
see her.
that.
Okay. There's the prescriptions, months of each of these. Okay.
Come, let's go. We'll get some outside. Thank you.
Fine. Well done. I will
Thank
see
you.
you. That's
Thank you
fine.
very much.
Blood pressure's very good, and we'll
Yeah.
see. I'll try and speak to IAT and see what they say.
Thank you.
Okay.
ट्राई करता था करके खाना
कैसे
ऐसे
सब इकट्ठे करेंगे
इतना बड़ा
Hi, I'm Sean with the doctors.
How are you doing?
I'm good. Come in. What can I do? I'm good, thank you. Yes.
Excellent.
What can I do for you?
Well, my wife and I are trying to have a baby.
Yeah.
And she's come in, she's a member of the same place as well. And
Yeah.
we've been trying for a little while now.
Yeah.
I know that we're in our mid-30s, so we wanted just to kind of like see, I don't know, maybe have a test to see how we're going. And, you know,
Sure.
I think she's already kind of had the first stage of testing done.
Okay.
And so that was just what we were kind of like hoping for. So, yeah.
Fine. How long have you been trying for now?
I would say probably we tried a little while ago, and it's probably been about 6 to 9 months now we've been trying for.
Okay.
So, yeah. Just getting that little bit of concern in place now because we've been trying to follow a schedule, see how it works, and nothing's really taken flight yet. So.
Okay, fine. And then she's come off the pill again, or?
Oh no, she never went back on.
She never went back on it.
No.
I see. So you just stopped using condoms, or?
Yeah,
something like that?
that's it. Yeah.
Okay. And how often are you having sex?
I'd say probably, I don't know, maybe like over the period, kind of like the window that we're given.
Yeah.
You know, we have one of those apps on your
Yeah,
phone,
of
so we have about
course.
4 or 5 day period or whatever.
Yeah.
So we probably have like sex at least once a day over those times.
Okay.
And then in between, probably, I don't know, maybe 2 or 3 times.
A week?
Yeah. I know, probably in between the time. Because of work and everything, it's hard to find the time. We
So,
try,
yeah,
but
so 2 to 3 times
the other 2
outside of the
weeks,
fertile window.
Yeah, that's it, yeah.
And what's your lifestyle like in terms of... You don't look overweight?
No, thanks. Well, I try and work out. I exercise. I play football once a week
Okay.
and go to the gym as well.
What about smoking?
No, I used to smoke, but I gave up about 6 months ago.
And alcohol?
I'm not a big drinker. Maybe like 4 drinks per week. I would say something along those kind of lines.
Yeah, not excessive at
No.
all. So there's probably not much you can do lifestyle-wise because you're already leading a pretty healthy lifestyle, really, aren't you?
Thanks.
Okay.
Yeah, no, I tried to, definitely.
Yeah, okay. I mean, let's get a semen analysis done for you, okay? And then we can see what that shows. You know, the majority of people will get pregnant. You know, so sometimes it's just a matter of time.
Yeah.
You know, if we can't find a problem, let's just keep having sex and it should happen.
Yeah, of course.
You know, probability-wise, even in your age group, you know, sometimes it would take longer than a year. But I think, you know, we would potentially refer you in another 6 months if you weren't getting anywhere unless we found a problem.
I've been coughing for weeks and weeks and weeks, and I've been given an antibiotic. It's not working.
Are you breathless?
I feel a bit breathless, yeah. And in the mornings, it's really, really nice. I've got really thick green phlegm, and sometimes it has blood in it.
It's just not going away. We've got to the stage where that's a bit checked out. Exactly.
Make some noise. Oh, the roar was good. The roar was good, but actually the singing was better, and we got to see right to the back of the throat.
I mean, they're all for the chest. The one you had is actually for the chest. I think the fact that you've had an antibiotic and you're still coughing, we need to do a chest X-ray to see what's going on with your lungs.
It looks absolutely perfect at the back. So she's looking good.
Hi, Sheila. Hi, come on in. Come and have a seat.
Thank you.
Right, I'm Dr. Beecraft. How can I help?
First of all, I had this this cough going on for a week now, and I know it's probably you've heard loads of people going on and on about their coughs, etc. But like I say, it's keeping me up all night. Can you give me some antibiotics for that?
Fine, let's have a seat. So, are you a smoker?
Yes.
How much do you smoke?
About, I don't know, 6 cigarettes a day.
Okay.
Yeah.
And is that something you've done for a long time?
Yeah.
Yeah, okay. And what are your thoughts about your smoking?
I don't have any thoughts about my smoking.
Do you think it's a good thing or a bad thing? Or...
It's not making me cough.
Okay.
It's something else making me cough.
Let's have a little look. Just pop that on your finger. And what is it you do for work?
I'm not working at the moment.
Okay. Right, well done. Slip that off. And can I get you to stand up and we can have a little listen to your chest? So nice, big, deep breaths in and out for me. Okay. Right. You have got some extra noise in your chest, so yes, I think you do need some antibiotics. I was just looking at your notes before you came in and saw that actually we never see you very often, but when we do, it was kind of about a similar thing back in December. My worry is you're getting these chest infections relatively regularly, and that's probably related to the smoking. When you're younger, you smoke and it doesn't really affect you, but over time, it will start to build up, and this is often what the pattern we see is people then start to get ill more quickly.
Okay.
So I think we need to be a bit careful about your smoking.
Okay, I'll quit then.
Have you ever tried to quit before?
Yeah, I think I've quit for a couple of years before, and I have, it's part of my sort of my morning thing. I have a roll up in the garden. I'll work on that. I mean,
because we've got some of our nurses here do kind of a stop smoking kind of session.
Yeah, and I think it's about you deciding to do it. Really,
yeah,
it's the,
so it's
the
kind
main
of
thing.
motivation. I think
Yeah,
is coming from you. But okay, I'm sorry, 3 times a day for a week.
Yes.
And then leave it a few weeks and then come back and see me.
Right.
And make it a double appointment.
Yes.
Okay.
Okay.
All right. Take care then.
Cheers.
Bye.
Hello.
How are you?
I need to pee. I need to pee, Aaron. I'm gonna go.
I'm so tired. Oh, I'm totally broken.
Really?
I had one of those big pints of Red Bull, so I'm going to go and have another one of those. Okay. Red Bull.
Onwards.
You get in there. See you later.
See ya.
The only thing is, sometimes if you have sex too much, your semen quality goes down.
Okay.
So potentially I would say during that fertile period is perhaps not have sex so much.
Okay, all right.
So probably 2 or 3 times a week
Okay.
consistently is probably better
Yeah.
than every day during that
Okay.
fertile period. Yeah. Let me get a semen pack for you. So this is the pot. So no ejaculation for 2 to 7 days, okay? Wash your hands, obviously, no lubricants. You masturbate into here, okay? And you need to collect all of the ejaculate, okay? Name, date and time on the bottle.
Okay.
And then you need to get it to the pathology lab within an hour of doing the sample.
Okay,
This is the
all
tricky
right.
bit.
Yeah, okay.
The other problem is that the hospital is not the local hospital.
Oh, okay, all right.
Logistically, you've got to think if that's possible.
Quickly.
Okay?
I've got a car, so.
If it's not possible, okay,
Yeah.
then they can arrange for you to have a room in the hospital.
Okay, yeah,
To masturbate in, okay? But you need to book
Everybody's
that, pre-book that room, okay?
All right, no
I don't think a horrible hospital room is be very pleasant, but you'll just have to think how long it's going to take you to get there, what time you go.
Okay.
And keep it warm, okay, in your
Yeah.
pocket. Okay?
Okay, all right, no worries. All right.
Tray. Okay?
No worries.
And then we'll find out. Hopefully it'll be fine.
Okay, all right.
Good luck, okay?
Well, thank you very much. Appreciate it. And
I will get the result and then you can give me a call for the results, okay?
Okay.
Once you've done it.
Cool. Wonderful. Thank you very much for
all
your help.
right.
Appreciate it.
Bye-bye.
Bye.
Well, I might still be here, but I finish at 7, so you might just catch me on the way out.
Okay.
Thank you
No
very
problem.
much.
It's all right for you. You can jump up like a whippet.
Thank you, Doctor.
Okay.
Good. All right. Take care. Bye.
Go on.
She does.
Very good.
Good girl.
All right, take it easy.